Hello, good evening. My name is Paul Story. This is the interview for the capstone assignment. The person I interviewed for this assignment is Tiffany Rick. She is a licensed professional counselor who has her temporary license in the state of Tennessee. She completed her master's degree 2 years ago in clinical mental health counseling. She currently works as a therapist at a local mental health hospital called East Tennessee Behavioral Health. She has worked there for almost a year and a half. Her job duties include a lot of different tasks to accomplish. First, I want to tell you more about the hospital she works at to give you a better idea of the working environment and just how much she has to do. There are currently 4 units at the hospital. There is a unit for mood disorders, so typically a patient will have primarily anxiety, depression, bipolar, or some other diagnosis that meets a mood criteria. Then there is another unit for thought disorders. So this would include primary diagnoses of schizophrenia, delusional disorder, depression with psychosis. There is an adolescent unit and also a geriatric unit, which are separated based on their age. Tiffany has worked on all 4 units, and they're basically ran the same, where there are certain requirements that have to be completed prior to X amount of hours the patient is there, or whenever other providers have completed their parts. Tiffany shared that the main paperwork they complete is called biopsychosocial, or psychosocial for short. This consists of numerous questions ranging from the patient's current living situation, history of their mental health, any legal issues, addictive behaviors and or substance abuse, family dynamics, children, or marriage. Previous responses to mental health treatment, an assessment called the mental health status exam, and then a clinical summary where the therapists put all the above information together to get a complete picture of the patient's presenting problems. The psychosocial is the first document to be completed once the patient enters the unit. Before that, the patient will undergo an intake assessment where they answer similar questions. Tiffany shared that the consistency of answers also helps show insight to the patient's mental status. The patient will then meet with activities therapists and psychiatrists to undergo other assessments. Tiffany's other job, once the psych evaluation is complete, is to complete a treatment plan. The treatment plan is done with the patient and includes goals and measurable tasks the patient will accomplish before they leave. The patient then signs this, and that is also Tiffany's responsibility to complete. Since this is an inpatient facility, Tiffany and the rest of her clinical staff are also in charge of finding and arranging aftercare for their patients. This includes something as simple as returning home or more challenging placements like residential all across the United States. Their other responsibilities include conducting process groups each day, which last an hour, and then documenting these groups with each patient's progress. There is a lot she has to remember about each patient and how much they did or did not participate. Each morning, Tiffany attends a treatment team with all the providers and insurance liaisons. Tiffany enjoys helping other people, and she finds the connections and watching people get better as very rewarding. Even if people have to come back to the hospital, she can build relationships with these patients and help them when they need it. The challenging aspect about working in the mental health industry is all the managed care requirements and tendencies to discharge people before they're actually ready to go. For example, Tiffany shared how patients are pre-approved for a certain number of days while inpatient. If they are nearing the end of those approved days, there's a lot of pressure to discharge even if the patient would benefit from more time. This is especially difficult on the thought disorder unit since some patients' mental health is more severe. Tiffany is currently going through her 2 years of supervision so she can be fully licensed as a licensed professional counselor, mental health service provider. She attends regular CEUs in the community too. Tiffany shared some recommendations for students trying to pursue work in the field of mental health, and it is to be aware of your burnout. Working in a fast-paced environment like inpatient facilities can lead to high rates of burnout because there are a lot of people coming in as soon as someone is leaving. It's also challenging to see frequent, repeat inpatient patients who do not have the resources necessary to maintain their mental health stability. She shared how being in a place like East Tennessee is helpful because there are a lot of resources nearby. She recommended I be aware of and keep good contact with community resources and other types of resources that our patients and clients will need one day. The interview with Tiffany was completed over the phone, and she was very knowledgeable in her field. She has become a very strong asset to the hospital because of how many connections she has made with aftercare options, referral sources, and relationships with the other providers. Tiffany is very outspoken, and it reminded me of how much of an advocate we need to be for our clients and ourselves in the mental health field. I know I want to continue working toward my degree in counseling, and speaking with her helped me realize that this is something I'm passionate about. She shared how much knowledge she gained from working inpatient, and it seems like that would be helpful to work there to get an idea of the systems of mental health treatment.